and welcome to the podcast. So today I am here with a fabulous sleep medicine doctor who's going to tell us a little bit about himself and kind of how you went on this track and kind of explain to us what that means. So please go ahead.
Hi, absolutely. So my name's David Earl. I am a sleep medicine physician here in Albuquerque, New Mexico. I have a little bit of a journey to sleep medicine. It involved being a pharmacist originally, working in Indian Health Service, then deciding to transition to medicine, attending medical school. I did a residency in psychiatry, subsequently a fellowship in sleep medicine, and now I work in both psychiatry and sleep medicine.
Okay, very interesting. Yeah. So a long path, but it sounds like it kind of got you where you wanted to be. And so I think the first question that I kind of just wanted to start off by talking about is a little bit about, we always hear different things about how much sleep we really need to be getting. So what is the official, doctor response to how much sleep should we be having?
Well, the official doctor response is it depends. Mainly depends on age group. So most people think of adults. We think of adults after age 26 as far as brain development. And so typically for adults after age 26, we think of between 7 and 9 hours. Turns out that it's genetically predetermined, but it's extremely rare for someone to be programmed on a biological level to consistently get less than 7 hours of sleep and have everything that needs to happen at night take place within their body and brain. In research studies, when adults have been left to their own devices without external cues such as alarm clocks or lights or noise, typically an adult will sleep somewhere between 8.2 and 8.8 hours. So that's the average, is somewhere around 8, and that's really the number to link onto is 8 hours. It may be give or take 10, 20, or 30 minutes one way or the other. There are certain types of sleep disorders where people sleep excessively long times, like 11 or more hours, that we will sometimes investigate and treat in the sleep clinic. But we know that most Western adults are consistently getting less than 7 hours, and their wearable devices give us that information. And that's pretty hazardous to health. So 8 hours is the magic number, minimum of 7. Older adults, it's a sign of biological aging. I see if an older adult is losing the ability to get a consolidated 7 hours of sleep at night outside of getting up to the restroom a couple times, something like that, that's usually a sign of their aging process. And so a much older adult, say someone in their 80s or 90s, it may only be 4 or 5 hours of consolidated sleep at night, but napping returns. Napping, I generally say it should not be present in anyone between the age of 6 and 66. Now, for older adults, if I have an 80-year-old that's still getting 7 hours or so of sleep at night, maybe they're taking a nap in the afternoon, maybe they're not. That's actually a pretty good sign that that person is younger, if you will, than their birthday would indicate. In children, it's much more variable, particularly in like infants, where it can be anywhere from 11 to 19 hours. And then in school-age children, it tends to be somewhere in the neighborhood of 10 to 12 hours, 9 to 11 hours as they kind of transition into adolescence. And so depending on the age and the developmental stage, the number of sleep hours does kind of progressively decrease to that 7 to 9 hour recommendation for adults.
Okay. Yeah, I remember when I first heard you say that, I was like, that seems like a lot and is not necessarily what I normally get or what I hear peers getting. So what's kind of the reasoning behind getting that much sleep? Like, what does sleep do for you?
Oh, sleep is extremely important. This is why I found my way to sleep medicine. I discovered in medical school, and I wasn't even aware that it was a specialty. Sleep, turns out, is important for every part of our body. We typically think of sleep as being something that's primarily important for the brain, of which it is. The janitorial process of the brain occurs during sleep. And That's such as removing all of the waste that's accumulated from the day. Our brains are very metabolically active because we have a lot of activity going on in our brain, including in older adults. And so I typically think of the brain as like a 24-hour factory, or like an airport, for example, where there's processes that need to happen during the day, and then there are processes that need to happen at night in order to prepare for the next day. And that's a lot of cleaning, if you will. It's when we wash away the toxins and metabolic waste from our brain. So in the brain, sleep is extremely important. And some of the more recent literature has shown that it's one of the incident drivers that lead to dementia, the sleep loss. They're definitely associated with each other. In the rest of the body, same story. There are processes throughout our entire body that are circadian, that are more active during the daytime and are more in a recovery at night. So for athletes, it can be muscle regrowth. Our heart is affected by sleep loss, and we can develop abnormal heart rhythms or arrhythmias when we're not sleeping well. And so pretty much any organ system of the body, including the immune system, is affected by the ability to sleep.
Okay, so it sounds like it kind of helps you clean up from the day and then rest and recover for the next day. Is that a fair thing to say? So what kind of happens if, it sounds like we're a society where, not many people are sleeping that much. What happens to you during the day if you're not getting an adequate amount of sleep?
Well, absolutely, we're a society that's not getting enough sleep, particularly Western societies. And now that people had wearables, we've seen that the average US adult is getting around 6 hours, 50 minutes, 6 hours, 40 minutes. And there's no recommendation that that's enough sleep for essentially anyone. What happens to us if we're not getting enough sleep? It is varied. So some of the primary things we think of is our ability to solve the problems of the day. In work like I do, problem solving could be affect recognition, making quick decisions, being ready for the day and the challenges that it has. So the health effects of not getting enough sleep are variable. We typically think of things like our ability to be ready for the day's challenges, particularly mentally. So problem solving ability, our being more irritable or not, which can affect our social life and our relationships with others. Accident risk when driving a vehicle is markedly higher when we're sleep deprived, particularly in adolescents, but all adults for that matter. And then just the function of our body as a whole, including things like blood pressure control or blood sugar control, which is really important to those who have diabetes. Also, poor sleep is linked to increased or worsening of cancer when people are struggling with cancer. So sleep has effects on all areas of health, but typically people that are sleep deprived are just not going to function as well mentally.
Okay. Yeah, I think that makes sense. I mean, I've noticed myself too, when I sleep more or less, it actually affects how much I'm able to do throughout the day. And you were mentioning people kind of work on a range. And my initial thought whenever I think about this is obviously okay, can I game the system in a way where maybe if I do more exercise or eat better, could that potentially decrease the amount of sleep I need? Is there anything you can do to kind of do that, or is it a set? Does that make sense?
There's nothing that someone can do that will decrease the amount of sleep that they need. There are some things that people can do that can help them fall asleep more easily. But really, at the end of the day, it comes to prioritizing allowing self a sufficient time to sleep. And that has to do with how busy we are. It also has a little bit to do with when our brain is tired and ready to go to sleep, because about 1 in 5 people have what are known as a delayed sleep phase. And delayed sleep phase is difficult in our early morning world, if you will, where they're not ready to shut down and go to sleep on a brain level until 12, 1, 2, 3 o'clock in the morning. As an adult and as a teenager, there's a 2 hour or so delay in our natural fall asleep time. And that can be quite early in morning hours before they're ready to fall asleep. Sometimes since there's a 1 in 5 chance, if it's somebody that has a delayed sleep phase, they can find themselves having quite a bit of difficulty falling asleep at a socially appropriate time, namely between 10 and 12 at night. And then they will end up with sleep deprivation, and so they may have a night where they're really tired, and so they'll fall asleep at a more socially appropriate time, and then as soon as they get some of that recovery sleep, they're right back to their natural sleep phase. And so one of the ways of figuring out how much sleep debt a person has and what their phase may be is what happens during a week off without a lot of responsibilities. So typically we think of a vacation where allowing ourselves to sleep in and capture recovery sleep, preferably without bright lights and a cool room that's dark, so 65, 68 degrees with little or no light, and even lights from like a clock have been shown to interrupt sleep. And there's stickers that can be purchased to essentially blacken out any sort of external light, but the darker the better. And after 3, 4, 5, 6 nights of recovery sleep and getting some sleep debt paid off that we will have accumulated from the weeks prior, a person will then have a natural falling asleep and awakening time that's consistent with what their programming is.
Okay. So, and then if you do sleep less, let's say throughout the week, is it possible to catch up on the weekend? Is that an actual concept that is good for you or it works? Or?
Yes, to an extent, it's better than nothing. That recovery sleep we typically refer to as insufficient sleep, or if it's causing some sort of daytime problem like performance at work or school, we refer to it as insufficient sleep syndrome, and it's very common, particularly in school age, including adolescents. And we do carry a sleep debt when we don't get the needed number of hours of sleep per night, no matter what age we are. Obviously, children have higher sleep needs. Even older adults still have sleep need and can have a sleep debt, and they'll accumulate that. During the recovery sleep, though, we don't quite gain it all back that we've lost. And while it's better than not getting the recovery sleep at all, it's still not ideal. The most ideal is to get the needed number of hours of sleep every night. That's the best for health.
Okay. Yeah, that's fair. That makes sense. Does napping, because you mentioned for elderly people, napping is a sufficient way to kind of catch up on that earlier sleep. So that is a fair thing to do, or?
Napping is normal in children typically under age 6. It's also normal in advanced age. And in very advanced age, 80s, 90s, napping twice a day, usually mid to late morning and again in the afternoon is normal. Similar to very young children early in life who will nap 2 or more times a day. In an adult between age 6 and 66 that's taking a nap, it's worrisome for either they're not getting sufficient sleep at night or they have undiagnosed and untreated obstructive sleep apnea. Typically, adults are not supposed to nap. Now, a lot of times an adult will have insufficient sleep and they'll feel the need to take a nap. While it can help with having a power nap, usually brief, and depending on the textbook that's referenced, anywhere from 15 to no more than 30 minutes, because usually after 20 to 30 minutes, we'll enter into a deeper phase of sleep that can be a little harder to wake up from after a nap. But power napping can help, especially if there's something rigorous going on that requires a lot of concentration or something like that, if a person feels the need to take a nap. And those can be helpful. For those who suffer from insomnia, taking a nap decreases their sleep pressure to fall asleep that night. And sometimes a person, if they've taken a nap, will have more difficulty falling asleep that same night. Other people, not so much. So when I see an adult napping, those are usually some of the considerations I have. May probe to see if insufficient sleep is the primary driver of that, or if they have undiagnosed, untreated obstructive sleep apnea, which frequently will cause that need to nap during the day. There can be other things, sometimes medications, if a person's on medications. It just really depends on the situation. But in general, naps are good unless they're causing a problem with getting sufficient sleep at night. I generally like to think that if the body wants to sleep, we should accommodate it.
Okay.
And when the body's had enough sleep, we'll be awake. And that's why it's really difficult to continue to stay asleep after we've recovered, or depending on what cues are. So if it's a bright morning, or sometimes throughout periods of the day we're just a little bit more awake. So you can still have somebody that has a degree of chronic sleep deprivation that still is waking up, and they're a little bit more active during the day, just because there are periods where the brain is more and less active as we go throughout the day and night cycle. However, generally napping is a sign of not getting enough sleep.
Okay, that makes sense. Listen to your body and it'll tell you what you need. Okay. And then I guess on that note then, what are some ways, like you mentioned earlier, there are methods to be able to sleep better, or sleep earlier at that time. So what are some of those ways that you can do?
Well, we typically in sleep clinics, and this can be in any clinic outside of a sleep clinic, will have what's called a sleep hygiene handout that has different things that can be done to help maximize sleep quality. And it typically includes some of the things I've already mentioned, like a cool room, 65 to 68 degrees. Note on that, children who are restless are much more thermogenic, if you will. They're just warmer than us. And all of us remember winter time when we were a child that we were very comfortable being outside in 30-degree weather in a t-shirt. Why is that? Well, children are heaters. And so a restless child, particularly a restless infant or a young child that's not sleeping well at night, it very likely could be because they're too warm. And typically you just need onesie or diaper and sheet. Older child obviously will take blankets off and sleep with just a sheet and a fan usually. So temperature is important, particularly for children, but everyone. Dark, which I've already mentioned. Having a television on in the room or any sort of light source really does interfere with sleep. Also quiet, noise, and some people really appreciate white noise machines, or if they live in a busy urban area, there is a degree of blocking of that the brain will eventually do so that they're able to sleep. But that stimulus is still being heard by the ears, and it can actually interfere with sleep quality. So quiet's very important too. So cool, dark, and quiet. Other key things are typically in pretty much any sleep hygiene handout are things like avoiding caffeine late in the day. There's a genetic susceptibility to caffeine. Some people will consume caffeine in the morning and it will continue to have effects in them later the same night, including causing them difficulty falling asleep or insomnia. Other people may be able to consume caffeine later in the day and it doesn't really profoundly affect their ability to fall asleep at night, but generally we recommend avoiding caffeine after midday. So avoid caffeine after lunch. A warm shower or bath can help with sleep onset. It helps make our skin warm, and it brings some of our heat, if you will, out to our skin, and we'll have a lowering of our core body temperature, and that can help facilitate falling asleep. So that tends to be in a lot of sleep hygiene handouts too. Another thing that's in sleep hygiene handouts that we've already briefly touched on is napping. Generally, it's recommended to avoid taking naps if a person's having trouble falling asleep at night. However, my caveat is generally, if there's not a lot of nighttime trouble and a person feels the need to nap, it can help them with performance. It can reduce their likelihood of getting into a serious car accident. I recommend napping if the body's wanting to do that and time allows.
Okay. Yeah, so it sounds like there's a couple things there. So caffeine, definitely avoid even in the afternoon. It'll
Depends
start
on the
affecting.
person, but generally late in the day caffeine will affect our ability to fall asleep at night.
Okay. And then I know that like sometimes people say like, oh, don't use your phone for like an hour or something leading up to sleep time. Is that true? Is that
Originally, there was a lot of anti-screen narrative about how it interferes with sleep. Some of the more recent information that's come out is that they do not seem to profoundly affect people's ability to fall asleep as we originally thought. It is still a light source. A lot of phones do have a dimming mode or a blue light reduction mode, definitely recommended. In general, people should not be spending long periods of time in bed using the phone. If they're needing to do something with phone, it's better to be in a different room and just associate the bed for sleep only. But as far as profoundly causing people to be up for many hours, it looks like it's more of the content that people are looking at. And particularly if it's something stressful, it can increase some of our stress hormone. Obviously, a lot of media is designed to grasp attention. Media is a business. And that can sometimes get people really worked up, if you will, and that could be contributing to their difficulty falling asleep. So generally, it's best to have phone out of the bedroom. Yes, that's still true, but does it make it where a person can't fall asleep for 3 hours? Generally not. The amount of light being emitted from them is not as problematic as like having a television on or other bright lights in the room or trying to sleep during the day.
okay? Okay. So there's nothing necessarily about it that causes you, apart from the content, to necessarily like if I decided to like study right until bedtime and then go to bed.
Ideally, it would be not backlit because that little bit of light can potentially suppress our melatonin release a little bit, but it's not as dramatic as originally reported.
Okay.
Now, non-backlit reading, or so like a Kindle or something like that that doesn't have the backlight, or just traditional book, that's fine.
Okay. And how does the blue light thing work? Because I've heard it a lot and I'm not really sure.
Blue light suppresses melatonin release. So it turns out that the molecule that makes us sleep at night is melatonin. It's actually how our entire body knows that it's dark outside and that it's time for the sleep period. And light suppresses melatonin release. Now, as we get older, we lose some of our melatonin secreting ability, but there's still enough there to still have sleep at night. A lot of times people will take a melatonin supplement and they'll feel like, well, it doesn't really work for them. And so one of the tricks to that is if taking a melatonin supplement, to take it earlier because it's a slower process, like 2 to 4 hours before their desired bedtime. So generally, if I'm recommending a melatonin supplement for a patient, particularly an older person, I'll recommend that they put the melatonin supplement at their dinner table because that's about the time that they should be taking it.
Okay.
And the light can suppress it more so than not having light exposure prior to bedtime.
Okay. And then does like doing like working out near bedtime or like eating or doing those kind of things, does any of that influence how much you sleep? Or
Eating is a bit mixed. It depends on what the meal is. Generally, we say avoid eating a heavy meal prior to bedtime. So typically 2 or more hours before desired bedtime is best. But as far as how dramatically it affects the ability to fall asleep, it's a little bit more wishy-washy. Exercise actually can help with sleep onset.
okay.
And now there may be some sources that say avoid exercise immediately before bed, but immediately before bed would be like within 10 or 15 minutes. For most people, when they exercise, there's usually a showering period. They may need to commute, and it's effectively going to be 30 or more minutes before they're ready to fall asleep after an exercise period. And anything 30 minutes and beyond, exercise helps. As a healthcare professional, I'm so excited if a patient exercises. I don't care if it's at 2 in the morning in the gym. It's usually the night owl or the type of person that has a tendency to naturally stay up later that's in the gym doing that. But I will never say anything counter to exercise. And as hard as it is to get people to exercise, whenever they do it that works for them, that's the best time to exercise. But it really does not profoundly affect sleep, other than it helps people have deep restorative sleep after they exercise, and exercising in the evening is absolutely okay.
Okay. And then just in general, like long term, like what is the importance of sleep in terms of like long term longevity, especially compared to exercise, or even like I know there was a few studies about how people who work night shifts tend to like not live as long or things like that. Maybe you can give some insight there.
Sadly, that's correct. People that work night shifts in particular ideally would have the same schedule for as many nights as possible. So 7 on, 7 off, or 10 on, 10 off, something like that's best. And on their nights off, they would stay in the same sleep phase. Now, most people don't want to do that because, well, there's not a lot to do on 1, 2, 3, 4 in the morning on your days off, and that's understandable. The shorter schedules where it's 2 nights on, 1 night off, 3 nights on, 2 nights off, those are extremely hazardous. Those people end up just not getting enough overall sleep, and it's the sleep deprivation, just like someone that does not work nights who has sleep deprivation, that is ultimately detrimental to health. So the restorative things that are occurring in the body during sleep don't happen when we don't have enough sleep, and that includes things like our immune system. Our immune system is the police of our body. And actually, at any given time, a person may have some sort of cancerous cell or cellular process going on within their body, but typically the immune system sniffs that out and removes them without us ever knowing. Some of the genes that control cancer, so what we call tumor suppressor genes that suppress cancers from growing, or oncogenes, which can make cancers actually grow. The regulation of them is altered in people who have interrupted or sleep deprivation compared to people who do not. So cancer is one of the big ones, but it doesn't happen in the course of one night. So insufficient sleep definitely leads to death, but it's over time. And so that's why there's not a news van outside the clinic every day when I go to work, unlike a pandemic where it's more immediate, if you will. Cardiac health is profoundly affected. Cardiology research has shown that we do have a finite number of heartbeats. We just don't know exactly what that number is. People who don't sleep as well tend to have go through the number of heartbeats faster. Obviously, exercising helps with that. We have a lower resting heart rate when we're in good shape. If there's something causing sleep interruption, that's where someone like myself becomes more involved. So getting a sufficient number of hours of sleep is very person dependent. They really have to prioritize allowing themselves to get enough sleep when their body wants to sleep. Now, for the majority of the people, that's between 10 at night and midnight going to sleep and waking up somewhere between 6 and 8. But about 1 in 5 are later than that, and around 1 in 100 or so are earlier than that. Once a person is asleep, things that are interfering with their sleep quality may need intervention. And it's the combination of insufficient sleep or poor sleep quality, or both, that ultimately have the detrimental health effects.
Okay, that makes a lot of sense. And then you mentioned that you see certain cases more in your clinic. So can you tell us about kind of maybe one or some of the common diseases that you see?
The most common disorder by far that is seen in sleep medicine clinics throughout the world, if there's sleep medicine services available, is obstructive sleep apnea, where people are essentially not getting enough air when they try to breathe at night. And that has to do with a combination of laying down. It's usually worse if we're on our back than side, and more relaxation in our body, because during sleep we have a more relaxed muscle tone. And the two things that are really key to life are heartbeat and breathing. And when one stops, the other is affected. And when we're having interruptions in our breathing at night, first our heart doesn't like it, but neither does our brain or the rest of our body. And so typically the airway will either narrow or completely close multiple times an hour, sometimes even multiple times a minute. And we won't get enough air in, and our oxygen will drop. And that low oxygen is very, very dangerous to all of the organs of our body, from brain all the way to feet. That's the most common sleep condition that we see. However, we only see the people that have been referred or are aware that they have sleep apnea. Obstructive sleep apnea is typically the type of sleep apnea. And since 1 in 4 Western adults, higher numbers such as Asian populations, it could be up to 40%, have obstructive sleep apnea, only about 25% of people that have sleep apnea are aware that, hey, I may have sleep apnea. So there's a large number of people that have sleep apnea who are not aware that they have that condition. And depending on how severe it is, it really affects their overall health. We typically treat that with a form of positive airway pressure that's still the most tried and true. It's basically a way of administering some positive airway pressure to help keep the airway open. The person does all of the breathing on their own, their sleep apnea goes away. We have a few different forms of that. We have one form called continuous, which is known as CPAP. We have another form known as BiPAP. Some people don't quite do as well on CPAP, but they do fantastic on BiPAP. So sometimes that's a trick for them. Maybe they've been to a sleep clinic before and they didn't really have the best experience, or they didn't feel like their sleep dramatically improved. It could be something like that. There are some alternatives, such as like an oral appliance that can be placed by a sleep-trained dentist. Sometimes they're cost prohibitive. Sometimes sleeping more upright or on our side with our mouth open, which are all signs of difficulty breathing, but can help us be able to breathe when we're untreated. So a lot of people who are untreated will snore a lot, breathe with their mouth open, wake up with their mouth dry. They won't be able to sleep on their back. And if it's really bad and they're not treated, they'll usually sleep upright, a lot of times in a chair. That's the most common sleep disorder that we see by far. There's a smattering of other disorders that we'll see and treat, some related to circadian phase, some related to insomnia, although that has a very high overlap with anxiety, and sometimes mental health professionals become more involved in addressing the underlying causes of insomnia, which typically different types of anxiety problems. There are people that sleep too much, what we call hypersomnia. They're much less prevalent in the population, but we will occasionally see those types of disorders and identify and treat those. Usually requires different type of testing at a sleep center and sometimes medications, things of that nature.
Okay. Yeah, it sounds like there's a lot of things that get covered under sleep medicine in terms of the disorders that you find there. Okay. And so then to kind of, I guess, just wrap it up, if there was like one recommendation or one thing that you'd want us to kind of take away from this talk, what would that main thing kind of be?
I think it's really, really important for people to be mindful, are they getting enough sleep? And what is the quality of their sleep? We as a society are chronically sleep deprived, and it has effects on the rest of our life. And when something's not going well for a person, be it in their social interactions and relationships in life, their workplace or school, it very likely could be related to not getting enough nighttime sleep. And recognizing that and trying to improve nighttime sleep can really help with all of the things that we have to do during the day. I typically recommend, if a person has the means, something like a wearable device, which are not necessarily the most accurate at different sleep stages. Side note that light sleep is our normal sleep stage on a wearable, And we are only supposed to get about 25% of deep sleep. Sometimes people are worried they're not getting enough deep sleep if they have a wearable. That's okay. Light sleep is normal. However, what they're also very good at is sleep versus wake and giving us our overall number of hours. And a lot of times a person can identify, hey, I think I have a sleep problem, by what their wearable device is telling them if they'll wear it while they're asleep. Oh, I'm not getting anywhere near 7 hours or 8. Or sometimes if there's oxygen drop or the heart's beating too fast for sleep, it'll trigger them of that. Another very reliable report of somebody may not be sleeping well is if they have a bed partner. Usually in the sleep medicine clinic, the bed partner has a lot of information, sometimes even including videos, like, oh, they don't breathe at night, I'm scared that they're dying, that type of thing. That can be very reliable for, hey, is there some sort of sleep problem going on at night? Because a lot of that affects us more than we think. Sleep is not just this unconscious period from when we are ready to end one day before we want to start the next. There's a lot of really important things that are happening during sleep, and our health suffers as a consequence without adequate and quality sleep. If there's a sleep quality problem, as I mentioned earlier, a person's allowing themselves enough time to sleep, or even if they're not, if there's something wrong with their sleep quality, they may need further intervention, and it may be something that they need to speak with their healthcare provider about.
Okay. Very interesting. Thank you for being part of this video and for providing all this information. I think it was super helpful. I learned a lot through that. And looking forward to seeing you around then.
Thank you.